This has been a very stressful situation for everyone, really, not only, in the country and the world, but particularly for people in healthcare. And we know that people at Johns Hopkins Medicine, caring for all these really sick people has been very stressful for people. Tell me what COVID's been like for you and for the unit.
It has been something that I don't think any of us will ever forget. There have been times that have been very hard, but I think that we found a great deal of support in each other.
Everyone kept emphasizing how it was a team approach and how they supported each other through this stressful year.
On this unit particularly, we have a very, very close group. Between our staff and our nurses, we're not just coworkers, we've been to war together this year, and so we have developed a very, very tight relationship.
The other day when I was rounding and talking to staff, I was struck by their stories of what it meant to care for our patients with COVID. Tell me, what was the hardest part of this for you?
I think it was not knowing what the course of the disease, the course of the virus could take on a person.
Mental health is taking a huge toll on people this year.
We occasionally saw patients become very sick, and watching it take that course was difficult.
Do you have kids at home?
I do.
How many kids do you have?
One, a 5-year-old. Mm-hmm.
5-year-old?
Yes.
So you had to balance that too?
I did. Luckily, I haven't gotten sick since working during the pandemic, and she hasn't gotten sick either. So I've been staying healthy and not bringing anything back home.
I think that the toughest part has been that everybody's job here was hard already. A patient, it was already hard to be a patient. A family member, it was already hard to be a family member. Everything has been amplified for everyone.
I'm optimistic that some of the stigma about addressing mental health may be able to be more normative, that people can get help.
When I had a bad day, that people would lift me up. If others had a bad day, I would lift them up, and that's why we make such a great team.
Has it been energizing when you look back? Is this draining?
I mean, it's very difficult because I think these patients are very, very sick. A lot of them are unstable, and it's very hard for the family not to see.
I've heard nurses say it can be lonely, but I will be able to look back and say, wow, this was an accomplishment.
Where do you find the hope or the inspiration to get up and come back and help your staff do what they do every day?
I get the hope and inspiration from my staff. That's the one thing I always say when I get up in the morning to come to work. I enjoy being here with them. I enjoy working with them. I like waking up and coming here every day.
This unit, the people here, the team that I work with, they all are so supportive.
I think I find hope when we see people discharged, patients discharged, that they do make it and they do go home and can be with their families.
I love my job and I love what I do. That's what keeps me coming back.
When everyone's going through something like this that no one's ever been through in our lifetime, to see everyone bond together, and I've shared tears, I've shared laughter, I've held hands.
Before COVID, we were all fairly siloed. Because of the response, we got to work shoulder to shoulder with these people and learn from them and see their ways of doing things.
When we go on the units and we listen to staff and those who are taking care of these COVID patients, it inspires me because they are so dedicated to ensure that our patients are well cared for. It's been the highlight of what I do on a daily basis.